Okay, so before we start with actual nerve injuries, we'll just have a quick review of anatomy of the nerves. So it's going to be bundled, whenever we talk about a nerve, it is going to be a bundle of nerve fibers or axon. Now each fiber is enclosed with endoneural tube or endoneurium. Why this is important to know is, now which type of injury, because we are going to learn different types of injuries. I am sure you must have learned it last year also. But then in which injury it is going to be epineurium which is going to be involved, in which injury it is going to be endoneurium which is going to be involved. That's the reason we should know where what is situated. So the innermost fiber is going to be enclosed by the endoneurium, or it's in the endoneural tube. Now what are the functions of this endoneurium? It acts as a packing so that there is not excessive movement of these individual fibers. Also, this is being elastic. It is going to, and it also resists the excessive stretch. After nerve injury, when there is a Wallerian degeneration, then this endoneural tube, it's like a tube. It's going to guide the nerve for the recovery, because the nerve has to enter that particular canal. So that's why it acts as a guide for the regeneration of the nerve. So to quickly review it, it is endoneurium is the innermost covering of the innermost fiber, and it is going to, the functions of endoneurium are important. It's from the point of view that it does not allow excessive movement in any direction. It is going to be, most important thing is, when the nerve recovers, it acts as a guiding tube for regeneration. Now when these group of nerve fibers come together, they form something called as funicula. Now each funicula is going to be covered with perineurium. So the innermost fiber, then the endoneurium. Now all these together will form funiculus or funiculi if they are multiple, and they are going to be covered, each funiculus is going to be covered by a perineurium. Now this is the perineurium being the outer structure, it has to be more stronger than your endoneurium, because it is going to be subjected to a lot of stresses, many stresses than your endoneurium. So function of perineurium is, it is a push, it gives a cushioning effect. So whenever there is any trauma, or there is any blow, or there is any injury, it acts as a cushion for this external compression. Now these funicula are packed loosely, and they are covered by the covering is called as epineurium. This is going to be outermost covering of a nerve. Now what are the functions of epineurium? It again protects the fibers against overstretching. Then amount of epineurium increases at the joints, because joints, the nerves are going to be more superficial. There are going to be a lot of compressive forces. So to avoid that, to avoid injury to those joints, or to avoid injuries to the nerve at the joints, there is going to be thickened cushioning, and that's why epineurium is more at the joint places for the nerves. So if you consider the cross section, it's going to be your epineurium outermost, then it's going to be in the epineurium there are going to be a lot of funiculi. Each funiculus has been covered by perineurium, that is red in color, right? And then its endoneurium is green in color, the small dots. Is it visible?
Yes, ma'am.
So just now we talked about, now in the reverse order, it is epineurium, then it's going to be perineurium, and it's going to be endoneurium. And endoneurium will have its axon, the yellow colored structure. Now what happens when there is an injury to a nerve? There are two phases. First phase is, there is going to be disintegration of axon and breaking down of its myelin sheath. This is called as Wallerian degeneration. It occurs distal to the level of injury. So it's going to be, the axon disintegrates,